Okay, so I'm going to verify my order and I'm going to assemble my equipment. Hello, my name is Destiny. I'm going to be your student nurse today. I'm going to provide privacy and I'm going to wash my hands. Alright, so I'm going to scan your bracelet real quick. Okay, can you tell me your name and date of birth? Okay, do you have any allergies? Okay, so I'm going to be listening to your lungs and checking your O2, your oxygen level, and depending on the percentage of your oxygen and the way your lungs sound, I will be suctioning out your trach, okay? So I'm going to go ahead and sit you up in a high phallus position. Wash my hands again. All right, I'm going to go ahead and stick this on your finger, and I'm going to listen to your lungs. Okay, so now I'm going to go ahead and remove this off your finger. So your oxygen is a 92, and you have adventitious breath sounds, so I'm going to be suctioning you out. And I can see about a quarter size of mucus around your trach. It's greenish, so I'm going to go ahead and wash my hands and set up everything to be suctioning you out, okay? So first what I'm going to do is I am going to turn your vacuum up to 80 to 120, and I'm going to turn your oxygen up to 100%. And I'm going to make sure the mask is over the trach, and I'm going to hyperoxygenate my patient. So I'm going to make sure I hyperoxygenate. That needs to sit there for at least 30 seconds to 3 minutes. So while that is sitting there, hyperoxygenate my patient, I'm going to set everything up. So this is what I have that's connected to the vacuum. It's the only thing that would fit into the end of my suction. So I'm going to remove that piece. That is not supposed to be on there for me to connect it. Alright, so I'm going to wash my hands and set up my field. So my solution is clear. It's not out of date, so we're good there. Okay. Move my gloves over. Alright, so now I'm going to pick this up. Set that in the corner. Alright, now I'm going to put on wash my hands, put in my sterile solution. Okay. Now I'm going to put on my gloves. Don't touch that or anything else. I can touch the sterile area. I'll lift this up. Remove that. Throw it away. Okay, I'm gonna wrap it around my hand. All right, so I'm gonna hold on to here. Now I'm about to dirty up my left hand because my right hand's my dominant hand. And I'm gonna grab this. Without touching each other. Okay, so now I'm going to end up dirtying up this white piece. I'm going to try out my suctioning. All right, and it works. So now I'm going to move the oxygen mask down. Okay, I'm going to go ahead and insert it. And I'm just going to wiggle it in without touching the red piece until the patient coughs and there's resistance. All right, and so now I'm going to go around in circles. All right, wrap this around, move the oxygen mask back on. All right, so now I'm going to listen. I'm not going to touch this piece again because I don't want to make my sterile clean dirty, my sterile glove dirty. Okay, so now I'm going to go ahead and put this oxygen thing on your finger so I can check your oxygen level. And I'm going to listen to your lungs. 1, which I would go a lot slower than that so I can hear everything. Okay, I still hear adventitious lung sounds, so I'm going to be suctioning one more time, but I'm going to wait at least a minute between suctioning so that gives me time to clean out my suction. So I'm going to clean that out. All right, so it's been a minute, and I am going to go ahead and do it again. So I'm going to go in, not touching. All right, there's resistance, and my patient is coughing now. I'm going to come out. Okay. Now I'm going to put the mask back on. Put this on your finger. Check your O2. I'm going to listen again. Okay. So it sounds clear now. So we are good. I'm going to remove this off your finger. I am going to curl that up into my glove. Remove my gloves. Throw that away. Wash my hands, clean up my area. Throw it in the trash. Throw that in the trash. All right, and then I'm going to wash my hands again, put on clean gloves. I'm going to clean around the trach, everything like that. Remove my gloves, wash my hands. And now I'm going to turn the oxygen back to the order prescribed. Turn off my down my vacuum. Turn that off. And then I'm going to make sure that the patient's bed is locked in lowest position. And now I am going to wash my hands again and document. So I'm going to document how many times I had to suction the patient, the color of the mucus that I've seen, the amount, how the patient tolerated it, the oxygen level, the breath sounds, everything that happened during this procedure.